With us today, have Mr. Xu from the Health Commission and Mr. Cui Yucheng from the local law enforcement authority, and also Mr. Cao from the designated hospital. First, I give the floor to Mr. Tu to give you the updated numbers. Friends from the media, good morning. Now I would like to give you the updated information regarding COVID-19, the containment efforts. 24 o'clock on September 15th, 130 confirmed cases reported, 1 imported cases, and 129 locally transmitted cases, and 3 asymptomatic cases. 3,718 close contacts, and also for the secondary contacts right now also in the quarantine places. So far, we have finished 2.34 million samples of NAT. So far, 110,000 items and also the 135,000 cubic meters have been cleaned. Right now, all the patients treated in the hospitals, and there's no severe cases. And we have done the following. First, we have pushed the efforts in the NAT. And now we have 16 labs for NAT, including 5 makeshift hospitals. And daily, the capability around 530,000. And we also issued the first edition of NAT plan, over 1,400 stations available for NAT. In the afternoon of 14th of September, we initiated the citywide NAT. Right now, we finish all the sample collection work. And we also have a supervision team to conduct the investigation work to make sure everything was implemented according to the plan. And also for the newly confirmed cases, all the epidemiological investigation should be finished within 24 hours. And for the close contacts and secondary contacts, if they're not in Putian or Fujian province, we issued the notification to other places. So far, we have issued 71 notice to the places in Putian and also 16 notification to the other cities. Let them know that the close contacts actually in their territory. Regarding the medical treatment, we have received help from the national and the provincial expert team, and also we make sure that the customized plan designed for each and every patient, make sure they receive a combined plan of Western medicine and traditional Chinese medicine. And we have a personnel from the different departments in the designated hospital, including the doctors from a pediatric department, from the psychological counseling department, and also nosocomial management, as well as nursing. Regarding the containment plan, we make sure that we will not see people going out, and make sure everything under control and operate in a safe manner. And we have also issued a notification regarding transportation checking. Make sure that the people in Putian not going out if not necessary, make sure that everything implemented accordingly and also in a strict manner. And right now we have around 24 teams with 270 personnel. Conducted supervision work in limited or restricted or lockdown places. And we also issued a further plan regarding the containment, the cleaning work, and also the COVID-19 containment efforts. And also we educate the public regarding the knowledge and method of protecting themselves safe. And we also worked with Sinopharm and other authorities. Right now we have a very smooth supply channels, and also regarding the daily necessity, we also put a close eye on the price of daily necessities and other anti-epidemic supply. Right now, the daily necessities, including dairy, meat, vegetables, all in very stable price with sufficient supply. And for the 5 large grocery stores, they also released the information regarding the home delivery information, so people can stay at home while placing orders, and they can receive their orders at their doorstep. So we do everything we can to make sure that people in the lockdown and restricted areas have enough daily supply. Regarding the key areas, we urge the medical institutes make sure that everyone should be tested. And also for the nosocomial management work, the people working inside the hospitals, they should also operate in a closed-loop manner. And also for the middle and elementary school students, right now they study at home, online. Regarding the quarantine place, right now we have 71 hotels and motels available for the centralized quarantine. 10,256 rooms available for people to quarantine inside. And also the sewage water and also the waste all managed in a unified manner. And also we have dispatched the professionals from the psychological counseling sectors to provide psychological service. And also at the same time, we received the help from the different places and provinces, and also from different sectors. The residents in Putian also very cooperatively received their NAT. I also would like to say a big thank you to all the companies, the institutes, and also the personnel involved in the epidemic prevention and control endeavor. And going forward, we'll do the following. First, we will speed up the efficiency of NAT, make sure that we're finishing the citywide NAT as early as possible, and also to for more rounds of NAT available, make sure that we can screen out the potential confirmed cases as early as possible. And for the confirmed cases and the asymptomatic cases, we will also speed up our efforts in epidemiological investigation, make sure all this information can be recorded within 24 hours. And for the restricted areas and lockdown areas, they should be strictly practice the lockdown measures. And for the treatment, make sure that the treatment plan from the cross-discipline personnel and also leverage the strengths of the traditional Chinese medicine. And also for the quarantine hotels, we make sure that there's no cross-infections happen. And we were also looking for the potential qualified hotels. If they meet our standards, that also can be the potential place for quarantine. And for the community level containment efforts, we will continue our practice, make sure that the people not conduct unnecessary out. And also for the PPEs, and we will purchase and store them in the inventory. And we'll also have a team of law enforcement to conduct the supervision work. Make sure all plans can practice earnestly. Thank you very much. Now the floor is open for questions. Please identify your media affiliation before raising questions. With Fujian Daily. A question regarding the personal treatment and donation. Right now in Putian, we have a 3-tier areas. We have Fengtingzhen, so that's the lockdown places, and the control area as the places in Xianyou County except Putian, except the lockdown place. And the other places in Putian is in the third territory. So basically, we have these 3 kind of the categorized areas. And for the vehicles, so they can go to the 8 places in the third category, which means that if their health code is in green, then they can travel to the 8 places except lockdown and restricted areas. If they have to go inside the restricted areas, then make sure they have a 48 hours valid NAT result. And also they need to apply for a license issued by the authorities. Thank you. My question regarding the color of the health code, how we can make sure that it will turn from orange to green. My question regarding the infected teenagers. So when they stay in the hospital, whether they are accompanied by their parents? Thank you for your question. Right now, 129 locally transmitted cases, 58 cases below 14 years old, and 57 below 12 years old, based on the national standards. It's not allowed to let their parents to accompany them during hospitalization. And also for the hospital, actually, we have provided services to accompany them, and also we have the different cartoons and scenes in their ward. So make sure they have a quite comfortable stay in the hospital. And also we have the book corner. So far we have more than 200 books available for kids staying in the hospital. So they can receive a medical treatment in an easier manner. And also based on the nutrition department, we also provide the nutrient and delicious meal. And for the younger kids, the nurses will also help to make sure they eat their meal. And also for the psychological counseling team, we also have the professionals to provide help to them, and the hotlines also available. So they are taken very well in the hospital. And talking about if the parents and the kids are all positive of COVID, then they can stay in the same room. If just kids, as the confirmed cases, then the parents not allowed to be accompanied, but we will provide potential care to them. Thank you very much. That's for today's press conference. Thank you.